Let's talk a little bit about what's involved in recovering from surgery. Now, when you go home the evening or the afternoon after surgery, it is normal to have some discomfort. Usually, taking some Tylenol and using the cool compresses as often as you can is helpful at improving this discomfort. It might get a little bit worse for the first 24 hours, and after that, pain tends to improve and starts to ease off. If you've had orbit surgery, you'll likely be given a prescription for some stronger pain medication, and you may take that for the first 3 to 4 days after surgery. The other thing to be really aware of is activity. Now, we want you to limit your activity for the first week. And what I mean by limit is no heavy lifting or really strenuous exercise that gets your heart rate up. The reason for that is because these activities increase your blood pressure and can increase the amount of bleeding, bruising, and the risk of having a complication due to these issues. So you want to take it easy. We definitely want you to walk around. I don't want you to stay in bed all week because, of course, that can put you at risk of developing other problems like a blood clot in your leg, but you do want to take it easy. Showering is something that patients often ask about. It is totally okay to shower 24 hours after your surgery. If you've had eyelid surgery, you just want to avoid the shower head spraying directly at the incision. So just let the water run down your head. The one exception to this is if you've had a type of surgery or a reconstruction where a big patch has been applied. Now, if I've put a patch on at the end of your surgery, I really want it to stay there for the full 5 to 7 days post-op. So try to keep that dry. That means taking a shorter shower, usually not something really hot and steamy that's going to make the patch less sticky. In terms of swimming, in general, I advise you to wait 2 weeks after any kind of surgery before submerging yourself in a pool. Now, in terms of other things that are normal in the first couple of days after surgery, it is totally normal to have a little bit of oozing or bleeding from the incision. You might have some bloody tears. The day after surgery, you might wake up and have a little bit of blood on your pillowcase. All of these things are completely normal. If you have significant bleeding or, a large volume of sudden bleeding, those are reasons to call and get in touch with us because that could be indicative of a more serious complication. Swelling is one of these things that definitely gets worse for the first couple of days after surgery. Usually, right at the end of surgery, patients don't look that swollen, but day 2 and day 3, the swelling can be more significant. After day 3, that usually starts to turn around and improve. So just be patient, it will get better. Using lots and lots of cool compresses the first couple days is very helpful with this. I tell my patients to use them as much as they can while they're awake, right? Don't wake up at night to put cool compresses on. But while you're awake, if you can sit with a bag of frozen peas on for 20 minutes, off for 5 minutes, and then if you have multiple of these little bags in the freezer, you can just sort of cycle your way through them. I think that is actually really very helpful. The last thing I wanted to talk about is blurry vision. Now, there are many reasons to have some blurry vision after surgery. For one, your eyelids are very swollen. They have some bleeding, there's a bit of blood in your tears, and that makes things blurry. But the second reason is you'll also be putting some ointment on the incisions and sometimes inside of the eyelids as well. And that ointment really blurs the vision, even if it's been several hours since you put it in. So blurry vision is totally normal after surgery. Now, if you have significant changes in your vision or vision loss, that's an emergency and you need to call ASAP to be evaluated.